Good morning, this is Peter Petros. I will discuss today simulated operations for control of stress incontinence and the unstable bladder. It is a clinical test. Mechanical support of ligaments or vagina mimics surgical repair to relieve symptoms and anatomy. The basis of SOS is the integral theory. The reason behind female urinary incontinence has to be looked for outside the bladder, that is in the structures supporting the urethra and bladder neck, specifically ligaments, pelvic floor muscles and vagina. Ligaments are the most vulnerable to damage because of collagen damage by childbirth or age. Now, the second thing is that integral theory states that OAB is a prematurely activated but uncontrolled micturition reflex. This is a simulated operation for stress incontinence. The hemostat supports the pubourethral ligament, you will see that in a minute, and this prevents the vagina and the posterior urethral wall being pulled open by these muscles during coughing or straining or effort. Now, the hemostat, there's a patient coughing. The hemostat is placed immediately behind the symphysis. It's behind the symphysis, and the patient's coughing. It's stopping the urine leaking, and now the patient's coughing again and restoring. This video, which I'll show you in a minute, demonstrates that OAB is a prematurely activated, uncontrolled micturition reflex. If you look at this diagram down here, as the bladder fills, the hydrostatic pressure presses on the stretch receptors and they send signals to the cortex. If convenient to micturate, then the micturition reflex is activated, and you see here the urethra is pulled open prior to micturition, bladder contracts and micturates. With the unstable bladder, if these ligaments are loose, either pubourethral or uterosacral, these muscles that contract against it cannot stretch the vagina to support the stretch receptors. So the bladder fires off at a low bladder volume, and this is called bladder instability, or OAB. This is from a patient with mixed incontinence, and the application of the hemostat, as you saw earlier, can stop the urine leaking with coughing, but also with mixed incontinence, quite often it can control the urgency. And the way it works is that the hemostat supports the ligament here and restores the ability of this muscle in particular, and also this one, to stretch the vagina and support the stretch receptors. The other part of the video you will see is that you can support the stretch receptors digitally, either with your fingers or even with a hemostat, to stop the afferent impulses. I will now show you the video.
The micturition reflex. Now the first time...
This is not only micturition.
The first time she did it, I did that, anchored the mid-urethra, it stopped. The second time I supported the stretch receptors, it stopped. The two are not incompatible. Do you understand? The first thing, see, when you anchor it, you anchor then the muscles can stretch the trampoline. There it is.
Another contraction.
Just watch this. You see? Straight away it stopped. Does everybody see that? Now we have... There, she's leaking urine. Yeah. Now look, the stretch receptors are here.
Yeah.
I'm supporting the stretch receptors. You see what's happened there, everybody? Look. I supported the stretch receptors and she stopped leaking. Did you see that, Louis?
So what we saw here, the hemostat controlled the pubourethral ligament. It supported it and restored these muscle forces which contract against the ligament. but also directly by supporting the bladder base. And here you will see an actual urodynamic graph where the urothelial stretch receptors were supported digitally from below. And here we have the graphs, abdominal, subtracted pressure, bladder pressure. Now, the urgency was controlled by the symptomatic urgency during urodynamics by digital support. When this was removed here, 4 to 8 seconds later, you can see here that the detrusor started to contract, and it was a phasic contraction consistent with what was then detrusor instability, which is now detrusor overactivity. But it was controlled by digital pressure, as you saw earlier in the clinical case.